With hypermagnesemia, hyper means over, and magnes refers to magnesium, and emia refers to the blood. So hypermagnesemia means higher than normal magnesium levels in the blood, and symptoms typically develop at levels over 4 milliequivalents per liter. An average adult has about 25 grams of magnesium in their body. About half is stored in the bones, and most of the other half is found within cells. In fact, magnesium is a really common positively charged ion found within the cell, second only to potassium. A very tiny fraction, roughly 1% of the total magnesium in the body, is in the extracellular space, which includes both the intravascular space, the blood vessels and lymphatic vessels, and the interstitial space, the space between cells. About 20% of the magnesium in the extracellular space, which would be about 0.2% of total magnesium, is bound to negatively charged proteins like albumin, but the other 80% or 0.8% of total magnesium can be filtered into the kidneys. So inside the kidney, that magnesium gets filtered into the nephron, and about 30% gets reabsorbed at the proximal convoluted tubule, 60% gets reabsorbed in the ascending loop of Henle, and 5% gets reabsorbed at the distal convoluted tubule. And that leaves only about 5% to get excreted in the urine. So, in order for there to be too much magnesium in the blood, this normal balance has to be disturbed. The most common reason is when those nephrons in the kidneys can't excrete magnesium properly, and so it starts to build up in the blood. And this can happen in renal failure, when the kidneys typically aren't able to excrete anything properly. Another cause of hypermagnesemia is ingesting more magnesium than the kidneys can excrete. Sometimes this can be due to an intravenous infusion of magnesium that isn't prepared right. Other times it can be due to a magnesium-containing medication like magnesium hydroxide, which can be used to treat symptoms like constipation and heartburn. If these medications are taken in excess over a long period of time, it can lead to hypermagnesemia. There are also some less common causes of hypermagnesemia. One of these is tumor lysis syndrome, which results from a large number of cancer cells dying at the same time, releasing their contents at the same time, which includes magnesium. Now, hypermagnesemia can cause some serious complications. At the neuromuscular junction, there are voltage-gated calcium channels on presynaptic neurons which need to open and let calcium in to cause the neuron to release neurotransmitter and ultimately cause muscle contraction. Under normal circumstances, magnesium seems to inhibit calcium influx a little bit, which actually helps stabilize the axon. But with too much magnesium floating around, it tends to inhibit calcium influx even more, which interferes with neurotransmitter release and ultimately slows muscle contraction. Also, normally the parathyroid hormone from the parathyroid gland usually stimulates calcium release into the blood. High levels of magnesium in the blood, though, seems to inhibit release of parathyroid hormone, which causes calcium levels to fall, leading to hypocalcemia, low calcium in the blood. And this can affect smooth, skeletal, and cardiac muscle, and can lead to vasodilation, muscle weakness, diminished reflexes, respiratory failure, and even coma. Really high levels of magnesium also alter the electrical potential across the cardiac cell membrane, which can lead to cardiac arrhythmias like heart block and even asystole. Now, anytime hypermagnesemia is causing symptoms, the level of free magnesium ions in the blood is usually over 4 milliequivalents per liter. Treatment for those symptoms depends on the cause, and if it's due to excessive intake, then you'd want to interrupt the source. Because of the interaction with calcium, some of the symptoms of hypermagnesemia can be countered by injecting calcium, usually in the form of calcium gluconate, which acts as a physiological antagonist. Sometimes furosemide can be used to promote kidney excretion of magnesium, and hemodialysis can also be used in severe cases. Alright, as a quick recap, hypermagnesemia refers to elevated levels of magnesium in the blood, which usually causes symptoms once it's over 4 milliequivalents per liter. This can be caused by impaired excretion by the kidneys or by increased intake of magnesium. The high levels of magnesium antagonizes calcium and can lead to a neuromuscular blockade, which causes symptoms like vasodilation, muscle weakness, and even cardiac arrhythmias. What's going on, guys? Hope you liked that video. Got a couple pieces of news for you. News number one is that we're almost done with all the renal videos, like all of them, which is super awesome and it's taken a long time, but we're almost done. We just have a couple like hypo and hyper videos left, so look out for those ones. News number two is that Osmosis is going to VidCon this year. So we just decided that, and we're kind of looking at tickets and stuff and getting excited for that. So if you're going to VidCon, look out for us. Maybe we'll see each other or something. I don't know. I went last year and it was a blast, so it should be fun again this year. As to the special thanks goes to Dibal for writing the script, as well as Rishi for editing the script. I did the voiceover and the illustration on this one, which was cool. So as always, you guys can help support us by donating on Patreon and following us on social media, as well as subscribing to our channel. All right, guys. See you later.